Hi, my name is Hugh. Today's training will be on the nurse's role in diabetic foot care, which can substantially influence the overall outcome of patients' health and quality of life. The purpose of today's training is to provide undergraduate nursing students with the knowledge and awareness of the effects of diabetes on the client's feet and how to effectively assess and care for patients with diabetic foot disease. As nurses, we are directly involved in patients' care. Therefore, it is essential that we know the purpose and goals of our nursing interventions in diabetic foot care in order to promote quality care and patient safety. After today's training, the students will learn how diabetes can affect patients' feet, demonstrate an understanding of the importance and relevance of performing a feet examination for patients with diabetes, and lastly, demonstrate effective cardinal technique when conducting an assessment of diabetic patients' feet. Foot problems are the most commonly seen complication in diabetic patients. It can result in high morbidity and mortality. Fortunately, these complications can be prevented with proper foot care. I remember when I was working in a nursing home a few years ago, I had a patient with diabetic foot disease. She was a sweet woman, positive, smiling, always saying hi to everyone. However, her diabetes was really poorly controlled, which contributed to her current condition. She came to us from home because her family no longer was able to provide her with the care she needed. She had a good-sized wound on her feet that developed from a small cut, and it's still not healing. And she has two toes that became gangrene. She wasn't a candidate for surgery because of her age and her uncontrolled disease process. It was heart-aching to hear her cry out in pain when we were doing her daily dressing changes. The pain medication did nothing to help her with her pain. Her condition had showed some improvements, but then it turned sour, and she ended back in the hospital. She became septic. This showed how important foot care can be. Had her family provided her with the necessary foot care to monitor and protect her feet from harm, her quality of life could have been better. So today, we want to stress the importance of foot care and the nurse's role in nursing intervention to prevent and manage foot issues associated with diabetes. Every 30 seconds, one leg is amputated due to diabetes worldwide. According to the American Diabetes Association, in 2015, it was reported that 30.3 million Americans had diabetes. 1.5 million Americans are diagnosed with diabetes every year. It is the seventh leading cause of death in the United States, with 79,535 deaths reported in 2015 associated with diabetes. Nationwide, every year, 9.1 to 26.1 million diabetics develop some form of foot ulcers. These ulcers can lead to infection, gangrene, and amputation if it isn't given the necessary care needed. Foot complications associated with diabetes are diabetic neuropathy, peripheral vascular disease, ischemia, ulceration, foot infection, gangrene, and amputation. Peripheral vascular disease and neuropathy are the two main conditions responsible for the increased risk of foot problems for people with diabetes. The first picture we see on top is neuropathy, which is damage to the nerve that causes loss of feeling in the feet, taking away the ability to feel any pain or discomfort. So patients are unable to detect any injuries. The second picture we see is peripheral vascular disease, which causes poor circulation to the feet, reducing the ability to heal appropriately. So a tiny cut will take a long time to heal, making it susceptible to infection. The last picture we see is an ulcer that has the potential of going all the way down to the bone. Because of poor circulation and neuropathy in the feet, a cut can easily develop into an ulcer that can become infected and not heal appropriately, which is common for diabetic patients. Because of these complications, diabetic patients can lose their feet, leg, or even their life. Diabetic patients have an increased risk for foot complications, so we want to implement the necessary steps to reduce and prevent these issues. Primary prevention is the identifying and modifying of risk factors to avoid foot problems related to diabetes. The first step of prevention is to identify those that are at risk, that is, our moderate to high risk patients. We want to encourage a healthy lifestyle, eating right and exercising, conducting those daily feet examinations, washing their feet daily in warm water, avoiding extreme temperatures such as hot water. Hot water can cause your skin to dry up. Stress to the patients the importance of wearing appropriate footwear at all times. We want to avoid any form of trauma or injury to the feet. Diabetic patients should also see a specialized trained professional, such as a podiatrist or nurse specialist, to keep their skin and nail healthy and well-groomed at all times. Lastly, patient education is vital. Providing patients and their family with the necessary education to ensure that they understand the importance of foot care and can demonstrate proper self-care when they're at home. Then we have our secondary and tertiary prevention, which addresses when a foot problem is detected. Secondary prevention is avoiding delay in the recognition of diabetic foot ulcers, and tertiary prevention is ensuring that there's adequate treatment available to minimize complications and promoting a positive outcome. When a foot injury is present, we want to avoid delay in the recognition and treatment of these issues. Treatment is a multidisciplinary team effort. The type of treatment would depend on the exact type of foot problem. Surgery or even amputation may be required in some cases. So we want to minimize that risk, treat the injury at the smallest level before it gets too severe, and amputation is the only answer. Nurses are healthcare providers who are actively involved in prevention and early detection of diabetes and its complications. The nurses' role could be in healthcare, community education, health management, or patient care. Nurses can play different roles. They can be providing care, care coordinators, educators, consultants, leaders, researchers, and advocates for patients' rights. Nurses are involved in various avenues when it comes to diabetic foot care. They are involved in the screening, the examination, and the treatment process. They are the first person that comes into contact with the patient, examining the patient's skin and reporting any findings back to the doctor. Now we're going to look at nursing interventions. The goal of nursing interventions in diabetic foot care is to improve patients' care and overall quality of life. Patients with diabetes should have their feet examined by a provider at least once a year. During a foot examination, the provider will check for poor circulation, any kind of nerve damage, skin change, or any kind of deformities. The provider will also ask the patient if they have noticed any problems with their feet. An examination may reveal decreased or absent reflex, decrease in sensation, making it difficult for them to sense any type of pressure, vibration, pinpricks, or changes in temperature. A tuning fork may also be used during the assessment to determine if there's any nerve damage and the extent of the nerve damage. Another nursing intervention is foot care. Nurses are checking their patient's skin every shift. Daily skin examinations help them spot problems early and intervene appropriately before it gets worse. Taking out the patient's socks, checking their feet, and in between the toes. They're inspecting for any type of injuries such as a cut, sore, redness, or swelling that can lead to other risks and complications. Patients are encouraged to wash their feet daily with soap and warm water. After washing, pat dry. We want to keep the skin soft and smooth by regularly moisturizing the feet to help avoid crackling of the skin, however, avoiding between the toes. Wearing the right size shoes and socks at all times is also important to protect the feet. Shoes that are too tight can cause pressure ulcers. Going barefoot is discouraged, even in the home, because it increases the risk for injuries, especially in the hospital. Hospital floors are dirty. Patients are at high risk for infection when they're going barefooted. Patients are encouraged to also inspect their shoes daily for any type of pebbles, nails, or anything that can harm their feet. Patients can easily get a scratch or cut when there is an unsuspected object in their shoes. Lastly, the American Diabetes Association recommends a multidisciplinary approach for diabetes foot care. Studies have shown that a multidisciplinary team approach can prevent diabetes complications and save the healthcare lots of money and reduce the risk for amputation. Appropriate care of the feet, vigilance, and evidence-based practice and treatment of diabetic foot ulcers can save the patient's limb and promote an optimal quality of life. Tightly controlling blood glucose is very important during the treatment phase of diabetic foot ulcers. Controlling blood glucose will enhance healing and reduce the risk for complications. The primary goal of treatment is to start the healing process as soon as possible. The faster the healing, the less chance for infection. The treatment route depends upon the presence and severity of the foot ulcers. Treatment of superficial ulcers usually include cleaning the ulcer and debridement by a provider. If the foot ulcer is infected, generally an antibiotic will be prescribed. For optimal healing, especially for the ulcers that are under the foot, we must offload it, which is taking pressure off the area by wearing foot gears, brace, or using wheelchair or crutches to reduce the pressure or irritation to the site where the ulcer is. This helps speed up the healing process. For a wound to heal, there must be adequate circulation to the ulcerated area. If part of the toe or foot becomes severely damaged, causing area of dead tissue, partial or complete amputation may be required. Amputation is usually reserved for patients who do not heal despite aggressive treatments, whose health is threatened by the gangrene. Untreated gangrene can be life-threatening. Patient education is important. We want to provide our patient and their family with the necessary knowledge about diabetic foot care so they can effectively manage it at home. It is important to get patients involved in their planning process of their care and treatment because it empowers them to manage their own health and make informed decisions about their care and treatment. It will also encourage them to take a more active role in their care, participating in foot hygiene, daily inspections, proper footwear, and promoting treatment of new lesions, all of which is to promote disease and ulcer management. People with diabetes have an increased risk for ulcers and damage to the feet. Many of these diabetic-related foot problems can be prevented by good control of blood sugar levels, combined with appropriate foot care and preventive measures. Once an ulcer is detected, seek medical care immediately. Foot ulcers in patients with diabetes should be treated to reduce the risk for infection and amputation, and to improve their function and quality of life. Before we end this training, it is worth noting how this training applies to Christian nurses. It exemplifies the biblical principle of education. Instruct the wise, and they will become wiser. Teach the righteous, and they will add to their learning. Proverb 9.9. Providing nursing students with the knowledge and foundation on diabetic foot care will foster the nurse's role in health promotion and management. If you have any questions, please email me. My email is listed below.